Let's talk about the WHO clinical definition of dengue. WHO classified dengue into a probable dengue, dengue with warning sign, and severe dengue. The probable dengue is a milder version. The dengue with warning sign is the more severe version, and severe dengue is obviously the most severe version of dengue. Probable dengue includes fever in a patient living in an endemic area, plus two of the following. And the following features are classic for dengue, such as a rash, usually a maculopapular rash, the patient with aches and pains in different parts of the body, such as eye pain, headache, back pain, joint pain, etc. GI symptoms such as nausea and vomiting. Along with rash, we will also find a positive tourniquet test where tourniquet shows that tourniquet test shows a number of petechiae more than 10 in one in square space in the antecubital fossa. That is a positive tourniquet test. And any warning sign are included in this. And what are the warning signs? You will talk about that in the later part. In this probable dengue, laboratory confirmation is very important. Next up is the dengue with warning signs. So what are the warning signs? So in dengue with warning signs, you need a probable dengue. You need all the feature written here, plus at least one of the following warning signs. Those are the warning signs. To easily remember the warning signs, think about abdomen. The abdominal features are the classic warning signs. So abdominal features such as persistent vomiting. Think about vomiting. Just vomiting or nausea is not a warning sign, but persistent vomiting is a warning sign. Then abdominal pain or tenderness, fluid accumulation in the abdomen, such as ascites, along with fluid accumulation in the pleural cavity, and hepatomegaly. So you see there are 4 warning signs in the abdomen: a persistent vomiting, abdominal pain on tenderness, ascites, and a hepatomegaly more than 2 centimeters. So those are the abdominal warning signs. What are the other warning signs? The patients may have a mucosal bleeding from nose, from the GI tract, or from other mucosa. And in CBC, you will find that the hematocrit is rising and the platelet is falling. In those patients, you need IV fluid. In the probable dengue, you need just expectant management. And in patients with dengue with warning sign, you need IV fluid. The most severe version of dengue is the severe dengue. In the severe dengue, you will have features of plasma leakage, or you might have severe hemorrhagic manifestations or features of severe organ involvement. Due to plasma leakage, the patient can develop shock, which is known as dengue shock syndrome. The patient can develop severe pleural effusion, leading to shortness of breath. The severe hemorrhagic manifestations may include GI hemorrhage. Severe organ involvement may involve organs such as liver, brain, heart, and kidney. Liver involvement usually is suggested by an ALT more than 1,000. Brain involvement will lead to a decrease in the consciousness level. Heart involvement will cause a myopathy, and renal involvement will lead to a renal injury or AKI. So those are the WHO clinical definitions of dengue. Remember, in patients with severe dengue, you need emergency treatment with ICU input.